So I recognize I'm the one thing keeping everyone from lunch, so I'll try to be somewhat brief. I'm one of the clinical fellows in the glaucoma department over at Wills. So I'd like to talk to you briefly about the different kinds of glaucoma. If anyone has any questions, please feel free to interrupt and we can talk a little bit more. But if you can't hear? Okay, thank you. So if we were to take the eyeball and look at it in cross-section, glaucoma is largely about the pressure, although that's not the entire story. But in the eye, the glaucoma is made, the fluid is made in a particular part of the eye called the ciliary body, and it actually percolates like this red arrow, percolates around behind the iris, comes out through the pupil, which is, if you look in the mirror and you see the small black circle in the middle of your eye, that's actually the pupil, and then it comes out to the front part of the eye, and it's drained in a location that's very close actually to where it is made. And when we're looking at glaucoma patients, we're actually looking at the angle here between the cornea and the iris, because this location is where the fluid drains out of the eye. So when we're dividing different kinds of glaucoma, we divide patients between open-angle glaucoma, and that's where that angle between the cornea and the iris is wide open, and then angle closure glaucoma. That's where the angle is closed, so fluid can't get out because the angle is physically closed off. So I'd like to talk to you about different kinds of glaucoma in those two different divisions. So primary open-angle glaucoma is the most common form of glaucoma. It affects 67 million people in the world, and it's the second most common cause of blindness. So these patients have an elevated eye pressure with, as I'm sure you've heard in other talks today, progressive changes in the optic nerve that correspond to visual field changes. And these patients, when you're looking at them, the angle is actually wide open, but the drain called the trabecular meshwork, is blocked. So the fluid just can't get out of the eye, and that's what causes the pressure to go up. So the patients with primary open-angle glaucoma often have no symptoms. They may have early, I made a mistake here, they may have early peripheral visual loss, and the central vision is actually only affected later in the disease. So signs, as doctors, we look at signs. We look at elevated pressure, visual field loss. So if anyone's gone to the screening, we're doing visual field. So we actually see visual field changes. And then we actually look at the vision nerve, and we can see damage there. So everything kind of fits together, and people have open-angle glaucoma. A few other risk factors are as I said, pressure. Age is a risk factor. Race, glaucoma, primary open-angle glaucoma seems to be more common in the African-American population and the Hispanic population, but anyone can get it. Also, a family history of glaucoma is a strong risk factor as well. And then I guess I had a formatting problem here, but other things like being nearsighted or diabetes or other things that can increase the likelihood of having open-angle glaucoma. So, like I said, open-angle glaucoma is when you see the drains open, but there's no obstruction. Secondary open-angle glaucoma is where you see that the drain is open, but it's clogged with something, and so we can see that oftentimes on examination. So different ways that it can be clogged. Some patients have pigmentary glaucoma, which is where pigment is released from the iris and clogs the drain. So it may be hard to see here, but if you see this dark band here, that's the drain. When we look at the eye, we can see the drain, but in people with pigmentary glaucoma, the drain is clogged with pigment. There's something else called pseudoexfoliative glaucoma, and that's where abnormal protein is made in the eye and gets distributed into that drain. So similarly, these things can clog the drain to make the pressure go high. There are other things like inflammation in the eye. Sometimes people can get infections in the eye or other things that can cause inflammation, which make the drain not work as properly. And also steroid use. Whenever you go and see the doctor, especially if you're seeing a doctor regularly and then the pressure one day happens to be higher and you're not sure why, oftentimes steroid use can cause the pressure to go high. So things like skin creams and inhalers for asthma that contain steroids are another culprit, and typically stronger steroids can cause more of a pressure elevation. So whenever you see the doctor, be sure to talk about any steroids that you might use. Other things, trauma can cause the drain to be torn, that would make the pressure go up. And if there's bleeding in the front of the eye, that blood can cause the drain. And even cataracts, very advanced cataracts can leak protein into the drain and make the pressure go up. So there's very, very many things that can cause the high pressure having an open drain. And the next thing to talk about is normal tension glaucoma. These are patients who similarly have an open drain, but they never have high pressures above the 22 or 21 cutoff that we oftentimes talk about. So if you see your doctor, oftentimes you'll want to know what the pressure is, but it's important to know that there are people who have pressure above 22 that do not have glaucoma. Similarly, just because your pressure is less than 22 doesn't mean that that glaucoma is not a possibility. And patients with normotensive glaucoma typically have a higher history of cold fingers, fingers turning white when you go out into the cold, or migraine, or maybe autoimmune diseases or hypothyroidism. So if any of these things pertain to you, you might want to consider talking to your doctor about them. To go back to that paradigm talking about the angle being open or closed, there are other forms of glaucoma where that drain is actually closed. So one form is acute glaucoma, meaning an attack of glaucoma. I don't know if you've heard of people talking about glaucoma attacks, but sometimes the drain, the angle between the iris and the cornea here is closed, and that can happen suddenly. So in these cases, it's an ophthalmic emergency. Oftentimes what will happen is that the eye will turn red, that it will become very painful, and the vision will be very blurry. And this is because the iris physically blocks the drain. So again, symptoms include redness, blurred vision, halos around lights. However, there is a treatment for this. It's called an iridotomy, where we make a hole in the iris with a laser and open the drain up. So, if you ever have symptoms like that, a red eye, painful eye, be sure that you go to your doctor, or, the Wills has an eye emergency department where they can take a look at you. And there's some other risk factors here, as you can see. And then, so angle closure can happen suddenly, or it can happen over a long period. So that's what we call chronic angle closure. There's many ways that the drain can close up chronically, one of which is what we call neovascular. So sometimes patients with diabetes or strokes in the eye or sickle cell anemia can have blood vessels that grow in the front part of the eye to close the drain up. So if any of these things pertain to you, you need periodic examinations. And then just very briefly, there are other forms of glaucoma called congenital or juvenile. So congenital glaucoma is when children are born with glaucoma from childhood. Symptoms, if a child with irritability or light sensitivity, tearing, or poor vision, need to be seen by doctors. There are pediatric doctors who look at children. And then signs, what we look at are children that have eyes that are larger than the other. So if you see here, the brown part of the eye is much bigger in this one than the other side, so there's an asymmetry there. And then this child has the cornea has become cloudy, so you can see here that the one cornea is different than the other. It's a different color. So any of these, abnormalities are things that we look for on exam. And if you, know children that have, asymmetries like this, then you should tell their parents to have them seen by a pediatric ophthalmologist. And then there's another form of glaucoma called juvenile glaucoma, which typically happens, in childhood. So Ray Charles actually had this form of glaucoma. So it's open-angle glaucoma that occurs in the first 2 decades of life. But the symptoms are very similar to open-angle glaucoma that happens later in life. So there's elevated pressure and visual field changes. But again, this is a disease of insidious onset. So it's important for children, especially having vision problems, to be screened for things like this. And actually, the Wills Hospital is doing screening where we go out into the community to local schools and try to find things like this in children. So that's all I have to say. Does anyone have any questions about different forms of glaucoma? I hope you could hear me. Okay, if there's no other questions, I think that... Oh, excuse me. Anyway, thank you very much for your time.
Okay, we're about to come up on the break, but I'd like to remind you about the continual going on of screening. We have a guest that just came in to tell us about the screening and remind us that it is for all ages. And he certainly is for the ages. Here's Ben Franklin.
Thank you, sir. Applause. Wow. I have attended the CARES conference many times, and every time I am here, I do get my eyes checked, because when you're 308 like me, you cannot be too careful. Now, since 2007, patients and their families have attended this CARES conference from all over the country. And for the past 7 years, the members and the people of this organization have donated their time and their service to inform the patients and to educate them about glaucoma and their families and caregivers and those who are at high risk of getting it. You see, it's also exciting to me that the members of this organization have introduced medical treatments and techniques which are now considered current standards across the globe. So they're for the common good. Now this speaks volumes to me because my lifetime was also for the common good. My ideas, my discoveries, my inventions, such as the lending library, the fire department, and also the first hospital right here in Philadelphia, which I am proud to say it is still in existence to this very day. Now, I may be known for what I am wearing today, the bifocals, but this invention does not compare with this organization's dedication, continued research, and how best to screen for glaucoma, and ultimately, how to cure it. So I thank you for your continued support, and I bid you all a good day.